they have essentially said that we're no longer in the business of trying to contain the pandemic because they have utterly failed at it. We are heading into, we have a situation in Utah right now where they're already starting to plan how they're going to ration ICU beds. And make no mistake about it, if they have to move into a situation where they have to ration ICU beds, what they're saying is we're going to decide that some of the people we are caring for, we're going to have to give up on treating them. We're going to have people die. This is when we heard about death panels during the ACA fight. This is literally a death panel, but this is just simply, you have limited resources. There has been a failed, if no attempt to contain the number of infections. At one point, it's inevitable. The infections bleed into more vulnerable populations, or frankly, people who just are not necessarily vulnerable on paper, but catch COVID. And we don't know exactly why young, healthy people will end up in the ICU, but it happens. And then your ICU beds, because of the nature of our healthcare system in this country, which is profit driven, you don't want to have too much supply, because you have too much supply that's going to cut into your profits. So you have a limited number of ICU beds and you run out of beds. You run out of beds and you have to make a decision. And what we're hearing out of Utah is that they're getting ready to figure out what that algorithm is, or what that what that formula is. And it's basically younger people get the ICU beds. Older people who have less of a chance of living anyways through, if they're that seriously ill with COVID, they get taken out of ICU. We could see this in parts of Texas. We could start seeing this in parts of the Dakotas. And this is a function of not fighting the pandemic. You can offer all sorts of therapies you want and treatments, but if you don't have the room and the capacity to get people into the hospital, it's not going to make a difference. Here is Mark Meadows, the chief of staff of the president of the United States, basically saying, like, we're done with the whole try and control the pandemic thing. We'll just focus on, what happens after you get sick.
Social groups and family groups. First, it was large groups. Now it's small groups.
It's
now
coming from all sorts of places.
Well,
it's
that's
coming from
exactly
all sorts of places
that's
because
exactly
the pandemic's
the point.
out of control.
So here's what we have to do. We're not going to control the pandemic. We are going to control the fact that we get vaccines, therapeutics, and other mitigation.
Why aren't we going to get control of the pandemic?
Because it is a contagious virus, just like the flu.
Yeah, but why not make efforts to contain it?
Well, we are making efforts to contain it.
By running all over the country, not wearing a mask?
Jake,
that's what the vice president's doing.
We can get into the back and forth. Let me just say this, is what we need to do is make sure that we have the proper mitigation factors, whether it's therapies or vaccines or treatments, to make sure that people don't die from this. But to suggest that we're going to actually quarantine all of America, lock down our economy.
No one's saying that.
Well, they are. Joe Biden's saying that. He says lock everybody down. We're going to have a dark winter. We're going to have a dark winter.
That's what health officials say. That's what health officials say, that it's going to get worse.
No,
we
that's
have the
Joe Biden's
worst days.
Jake,
let's be honest. Infections, Friday and Saturday.
Let's be honest here. The health officials did not say dark winter. Those were Joe Biden's words.
When we look at a health official, I think he was quoting William Haseltine.
When we look at the number of cases increasing, what we have to do is make sure that we fight it with therapeutics and vaccines, take proper mitigation factors in terms of social distancing and masks when we can. And when we look at this, we're going to defeat it, Jake, because we're Americans. We do that. And this president is leading while Joe Biden is sitting there suggesting that we're going to mandate masks.
The president is holding rallies all over the country.
That's correct.
No
In fact,
masks,
we're leaving.
No masks required, no distancing. There have already been, according to health officials, contact tracing. There have already been cases of individuals in Minnesota and in Washington, D.C., and in Oklahoma that got the virus at these Trump rallies that Dr. Fauci himself called a super spreader event, the one at the White House.
There's also been contact tracing, Jake.
That is not leading.
There's also been contact tracing.
Yeah. I mean, I don't even know what else there is to say at this point. They are just going to say that, like, catch it, roll the dice. And if you're one of the lucky ones who don't have a bad effect, doesn't have a bad effect on you, then you're good. If you're one of the unlucky ones, we will treat you, but we have no plan for situations that are happening like in Utah, where there are so many people who are going into the ICU that some are going to have to be literally taken out of the ICU to make way for people who have a better chance of surviving. I mean, this is... And the idea, like, look, it is increasing all around the country, the world, where winter is upon them. You look in places like the Dakotas, you look in places like Utah, you look across Europe, you look at those temperatures, they're starting to get down to the 40s and the 50s. And we all heard when it hit in the early or late winter, early spring here, it's going to go away in the summer. It's going to get easier in the summer. Well, maybe it did. Maybe it did get easier in the summer. And we are now seeing day after day record number of infections. And maybe it's getting worse in the winter. And the real question is, like, what did we do with those 6 months where it was sort of ebbing, relatively speaking? Did we develop rapid testing? Did we develop a regime for contact tracing? Did we develop strategies for dealing with hotspots? I mean, maybe in some locales, but not in any national way. And they know they're at the end of this, so they just say, yeah, screw it. We're just not even going to concentrate on it. Here he is. He tries to walk back. Meadows tries to clarify this morning on the statement, but in the course of saying it, he sort of indicates that no, actually, what I said was I'm almost double downing on it. Listen to Mark Meadows today from the White House.
Well, the only person waving a white flag along with his white mask is Joe Biden. I mean, when we look at this, we're going to defeat the virus. We're not going to control it. We will try to contain it as best we can. And if you look at full context of what I was talking about is we need to make sure that we have therapeutics and vaccines. We need to make sure that when people get sick, that they have the kind of therapies that the President of the United States has, that we can provide. Those emergency use authorizations hopefully will be coming in very short order.
I mean, he, in the midst of saying, no, we didn't wave the white flag, Joe Biden waved the white flag and his white mask. He literally mocks Joe Biden for doing exactly the one thing that every expert at this point says will mitigate the spread. The statistics run from 95% mask wearing in public would reduce the number of deaths by the end of the year by 100,000, by February by like 125,000. And he is out there claiming we're not giving up on controlling the spread of the pandemic, although I'm going to mock somebody now for doing the one thing that would have the greatest impact in controlling the spread of it. That's his answer. I mean, just even the compulsion of, like, I mean, why? I don't even understand what is the mentality. What do they think they're getting out of this? That there's a lot of people out there. I guess they're just trying to rally all the people who are like, well, we're not going to mitigate this. And I am voting for the president who has come out and forcefully said, we're not going to try and control this pandemic. That's the president I'm looking for. The one who's going to not just not control the pandemic, but make it a point of pride. Pretty shocking stuff.